Hello everyone, my name is Marcia Marquez and I am presenting using a whole class token economy and coaching of teacher skills in a preschool classroom to manage disruptive behavior. This study looked at behavior problems in young children in educational settings. There has been an increase in behavior problems, which has led preschool teachers to seek and implement new behavior management strategies. Since this problem is widespread, a whole class intervention may be most efficient. This study compared token economy versus a parent training intervention to determine which is most effective for behavior management in the classroom. Token economy is an intervention that utilizes tokens, such as stickers, clips, or fake money, to increase desirable behavior. When the desired behavior is displayed, participants earn a token. These tokens are then exchanged for rewards. Currently, research shows that a class-wide token economy is effective in reducing the amount of disruptive behavior and increasing on-task and appropriate classroom behavior in elementary students. Research has also shown individualized token economies to be effective in increasing appropriate classroom behavior and decreasing inappropriate behavior for preschool students. The study hypothesized that a whole-class token economy would be an effective intervention to manage inappropriate and disruptive behavior in a preschool classroom. The study looked at two interventions, the level system and parent-child interaction therapy, PCIT. The level system is a whole-class token economy. There are 7 levels, ranging from a bright happy face to a sad gray face. Children are rewarded a few times throughout the day for having their shape or their token on the top 3 levels. PCIT is a 12-week program for kids 2 to 7 years old. There are 2 parts to the intervention, child-directed interaction and parent-directed interaction. In child-directed interaction, parents use positive parenting skills, such as praise and enthusiasm. In parent-directed interaction, parents give effective instructions, 2-choice statements, and timeouts. This study included an out-of-control preschool class with 17 children. The average age of the student was 2.9 years old. 65% of the class were girls and 35% were boys. 88% of the class were Caucasian, and all of the children came from homes with 2 parents. There was 1 teacher and 1 aide, whom changed several times throughout the year due to a high turnover rate. Observations took place during circle time for 1 hour per session. All of the sessions were videotaped. There are several measures used in this study. A school observation coding system was used to measure inappropriate child behavior. Coders viewed the videotapes and determined the number of instances of inappropriate behavior. This number was then divided by the number of children per session, which was then divided by the number of minutes per session, which resulted in a number of instances per child per minute. A teacher behavior coding system was used to identify 3 teacher behaviors, labeled praise, unlabeled praise, and criticism. Connor's Global Index was used to measure individual child behavior before and after the treatment. A parent interview was conducted with 15 questions to measure parents' acceptability of the classroom behavioral management strategies. A Likert scale was used to measure classroom manageability, a timeout log was used to keep track of how many children had a timeout per day, and another scale was utilized to measure teacher satisfaction. Prior to beginning implementation, the teacher received training on each of the interventions. She also received coaching on her implementation throughout the process. After training, the teacher began to implement each condition via an ABACC design. The A condition represented no intervention. The level system was represented by the B condition, and condition C was the PCIT intervention, such that the first C was the CDI and the second C was the PDI. Each observation session was videotaped and coded for child and teacher behaviors. There was an overall 80% inter-rater agreement. The results showed that there was a decrease in disruptive behavior throughout the study. Means for each condition are as followed: 0.45 instances per child per minute at baseline, 0.27 instances during level system intervention, 0.21 instances during withdrawal phase, 0.12 instances during CDI condition, 0.06 instances during PDI, and 0.05 instances during follow-up. Classroom management remained stable throughout the entire study. The teacher was most satisfied with PCIT. However, she chose to implement the level system at the end of the study. While both interventions were successful in decreasing inappropriate behaviors, PCIT was shown to be most effective. A possible explanation for this may have been due to the low levels of treatment integrity for the level system intervention. Some considerations to look at when implementing behavior management strategies is the amount of teacher training required. PCI training required significantly more time than the level system. A limitation of this study was that it consisted of only one class. A combination of both interventions may be most effective when utilized for a class that has excess disruptive behavior and when there is a lack of teaching skills.